Miami-Dade County is partnering with you to help keep our community safe from COVID-19 now and in the future. Do your part by getting your booster, staying home if you're sick, and getting tested if you think you have symptoms. We'll keep doing our part to protect our children's education and ensure testing, vaccines, and boosters are available for all so that our entire community continues to thrive. It's our best plan. For more information, visit miamidade.gov/coronavirus.
Okay, ladies, I think we got it right this time. I'll tell y'all all about it later. I am Stephanie Behar with Stephanie Creates, and I have come here today thanks to Miami-Dade County and the Our Best Plan to make sure we share with you what is up with COVID-19. We definitely need to know where we are today. We've come a long way, and we'll talk about it with these two ladies. We have Dr. Cheryl Holder and Stephanie Behar. I'll let them tell you their credentials because they'll do a much better job at it. Dr. Holder, can you share with us who you are and what you do?
Hi. Hello, Stephanie. Thanks for having me. I'm Dr. Cheryl Holder. I'm an internist. That means I take care of people from 13 all the way till the end. I've been in Dade County for 30 plus years, providing care from all over the community with the Jackson system, and now with Herbert Wertheim College of Medicine, where I teach medical students, see patients, and work on the COVID initiative with many of the Black health professionals to get our community vaccinated and protected and safe from coronavirus.
Okay. And Stephanie, could you tell us who you are?
Yes, so I am a Miami native, born and raised, but I'm now in Massachusetts, working at the University of Massachusetts Medical School, working on a project called RADx, the Rapid Acceleration of Diagnostics, which is an NIH initiative, which was started to help increase the availability and accuracy of COVID tests, particularly rapid tests and now the home tests.
Okay. We talked a little bit about this earlier. You're both on opposite sides of the country. One in, hot weather area, and Boston's hot right now, but typically cold weather area. There's been, I guess, sort of a myth or an idea that if you're in warmer weather, it's better with regards to COVID and contracting the disease because we're outside. And the chances of us catching it is much less prominent. But we've seen an uptick in positive results. So I just kind of wanted to glean from, what is your thought about that? Is that true information?
As a doctor, as I explain to my patients, viruses that are spread through the air just need you to be in close proximity to the other person. And if you're not protected with a mask and you're talking and hanging out, you're likely to pass it on. Mm-hmm. So if you're socializing outdoors or indoors and you're close together, you're going to have a risk of passing it on. Now, indoors, absolutely easier because the air doesn't circulate. There's more concentration. So yes, in winter months, you'll see an uptick, but the uptick will be more than the uptick in the summer months. But if you have a virus that's easy to latch onto your nose and get in there and make you sick, just being close enough, whether you're outdoor or indoor with an infected person, will increase your chances. And we don't really socialize outdoors like people think in Florida because it is so hot.
and we got to go to work.
Yeah, even the bars, you're air conditioned and close together, even if you're somewhat outdoors. So it's not the real idea that we're running around outside.
All the time.
All the time, right.
So Stephanie, let's talk a little bit about testing because I think that's your area of expertise. You were focused on an initiative that is a speed innovation to the implementation of testing. I believe, and maybe in my research, we are a society that's getting better at the testing end of it. What was your work about, and what were some of the solutions that you came up with?
So we partnered with a lot of testing manufacturers and companies who needed data to apply for emergency use authorization from the FDA, which is how these tests are being approved. So we worked with a lot of these companies and were successful in getting this data, and a lot of them went on to get that approval. And we've also done a lot of work with the home tests that are available at drugstores, and I think are the most commonly used and accessible tests right now. We did similar work with those, but we've also done some studies digitally and around the country, so people are able to participate in these studies from the comfort of their homes, studying the testing behavior and reporting behavior of people who are using those tests.
So, Dr. Holder, I think you said earlier that the home test solution, which I think is one of the things, and I'll say I'm one of the people that has a home test, has been a very positive thing when it talks about working practically with clientele. Can you share a little bit more about that and why?
Yeah, well, that's why the research comes together. It's sort of the marriage with the doc. How do we translate what the researchers do to our patients to have them use the material? And the home test, I was just in the clinic last night at Jesse Trice and the federally qualified health centers, Jesse Trice, CHI, Borinquen, the places in Dade County. They have a supply that's ready for the community. So we were opening up the kit and showing my people in the waiting room how to use it. And it was very simple. It was so easy to show that the swab only has to go in about this much, right on the outside, spin it around about 4 times, put it in, time everything. And in 10 minutes, depending on 10 to 20 minutes, depending on the test that we used, you'll have an answer that will help you if you're having symptoms, help guide you a little bit, whether you should go out and hang out with friends, whether you should, how much masking. So it'll help you a little bit relieve some of the anxiety until if you're really negative and have more symptoms, then go get the other test, which is the one that's more specific, the PCR. The home test gives you an idea, and if you have anything, you go get the other test. But at least you get that initial relaxation that, okay, I was exposed to somebody, my test twice was negative, or I'm having symptoms and it's positive, and immediately I can stay home. So it is very helpful.
Well, thank you for explaining a little bit about how the tests are done. I think we were laughing earlier about how it's come a long way from what we used
Oh,
to have to do. So
I
it's a
am
much
so
easier
grateful for that,
process.
because my patients did not want to go get that thing jabbed into the back of their nose, which they used to call the dagger.
And hold your breath.
And hold your breath. Then they had the one in the back of the throat, and it looked like you were choking. So then they're like, I want to choke. I don't
I
want to
don't
stick.
want to do that.
This
So,
one is really easy, and nobody should be afraid of it. So we've come a long way.
yeah,
And it's getting
exactly.
better. We're getting better.
Now, I heard something interesting the other day, and it kind of lends to, I guess, myths and conspiracies, um, and even truths that I just wasn't even aware of. I learned that some people are apprehensive about taking tests because if you are positive, you have to sit out for what is it now, 10 days, and then another test, and et cetera, which impacts people's jobs. So, how are there any conspiracies or thoughts or ideas out there that are
Well,
making
the
people
good
scared of
thing,
taking
it's not 10
tests, and
days.
what are some of the solutions?
It's not 10 days. The new guidelines,
Okay.
and this is where everyone, you can go on the CDC website, or you call your doctor or call the health department, and that will give you some guidance that it's 5 days. And depending on how sick you are, you should probably get medications. If you're 65 and older, if you have some illness, you should call up and get medication so you cut your time of being sick. So
Okay.
if you're not in that risk group and you don't need medication because you're young and healthy, you put on your mask, you stay away from others, including your family members, for 5 days. And at the end of 5 days, you can go outside fully masked till another, at least, we say at least 5 more days, because the virus, by 1 week, at least 70% of what you have is not going to infect somebody else. More
Okay.
people are non infectious. But definitely by 2 weeks, 3 weeks, you may still test positive, but you're not going to infect anyone. So that's why they changed the recommendations.
Okay.
But it's so important that if you have diabetes, high blood pressure, obesity, and you're 50 and older, please go get medication to make sure that you stay well enough and not get severe disease. Don't stay home and wait and see how I do. Just go get treated so you know you're safe from getting
And is
severe.
there a treatment that's outside of the vaccine?
Oh yeah,
Okay.
5 days. A drug you take twice a day.
Okay.
We've come a long way in coronavirus, and this because researchers like Dr. Behar here, we wouldn't have been here without all the science and all the effort. So yes, 5 days, and you can get control to guarantee that you're not going to get severe disease and death. We don't have the research yet to prevent infection, but we can prevent severe disease and death, which is so important.
Well, Stephanie, Dr. Holder just shared something that we can tap into. You know, there is a thought, I guess, out there that this is something that will never go away. Um, I am one of those people that believes that's the case, but we're just going to learn how to manage it. But what's the research saying, and how are we working toward that manageability, or do we think we're here yet?
I mean, at least in the research I'm doing, I don't know, what the future is going to look like, but I think we can, do our best to control it in the moment and, test and do what we can to prevent it from spreading as much as we can and hope that, we end up in the best shape that we can.
Does the research look like, um, or our researchers even working on trying to just stop the disease completely, or we haven't been able to advance to that point yet?
I mean, I think everything we're doing, both in the type of research I'm doing and elsewhere, is to, control it as much as possible and decrease it as much as possible. I don't know, entirely what research is out there to
Okay.
kind of for the
Now,
future. But
yeah, with viruses, all viruses, after a while, if we don't change if the variant doesn't sort of go wacky at one point, most viruses eventually get less and less toxic, killing you, and you get to this point what we call where it's kind of floating around like cold virus. Now that's partly because so many of us have been infected and vaccinated that when you get it, you don't feel as sick. So
Okay.
you think, okay, it's getting better. And they see that trending with coronavirus, where it's more infectious, but folks aren't getting as sick because so many people already had it and had it once or twice, or many people are vaccinated.
Okay.
So they track it across the world, like South Africa does great tracking, but South African population is already very infected. So had been, so they're not doing poorly with the newer variants.
Okay.
So the ultimate goal is to get that preventive vaccine. And there is some research, different places, of this unique vaccine that will build up enough antibodies and response in the nose and in the upper, because that's where the virus comes in, back of the nose, hooks on.
Okay.
Our present antibody level when we get the vaccine doesn't go up high enough
Okay.
to prevent you from what happens in this area. So there are people looking at nasal spray response, that the vaccines goes in here. So then you get the level. So when the virus comes in, you got that protection. You have that, that shield comes down in the nose, physiologic shield. So it's not like the mask, but it's like your body creating an internal mask because that nasal thing that we did, that's in research. Hopefully, the way the science is going, I'm very optimistic that we're going to get something that will prevent it. But
Very
for now, we don't have to get sick and die. I think that's a win. That's a win.
That for me was the most important part, to be real honest with you. I was like, I just need
Exactly.
this to stop enough that
Yeah,
if I get it, I will not die.
exactly.
Um, so let's talk a little bit about the vaccine thing. The vaccine, I've been looking at the numbers. It seems like people are starting to get vaccinated. And I'm curious to figure out if that's because, what am I trying to ask? Is that because people are now starting to trust the science? Um, could some of that be because we have a different political climate? Or is some of that maybe I had the virus and it was a very serious thing and I need to take this seriously? What's starting that uptick in that arena?
Can I check all of the above?
Choose a percentage. Choose a percentage.
Choose a percentage.
Any given day.
I would put it to knowledge, personal knowledge of the virus, but also I got to commend our community partners. We were out in force for the Black community, and the data is showing minority communities, unfortunately, that the death rates of whites are surpassing that of Blacks, which comes to what was the community's response. And when you have trusted messengers, your pastor, your grandma, your auntie, your everybody saying, get this vaccine, we want you to live, I think that turns the tide. And the data is beginning to show that's what it is, that is turning the tide. So, yes, the trust is built up, but we've learned better in who to give that trusted message. And it may not be the researcher, it may not be the primary care doctor, but it might be a combination of family and trusted doctors and mobilizing the strengths of our community to get the message across. So then, yes, they do trust us to take a chance. They're still waiting on the science, to trust the science, but they're going to step out on faith and go that extra mile and try the vaccine. So
definitely in our communities, we have a little bit more trust issues just because of our historical past in terms of the medical.
And it's the right way to be. I mean, you can't come from that history and not say, wait a minute now.
Wait a minute, what's happening here?
And I'm like, it's okay. I'm with you on it. But let's look at the science. And there's a time where you have to balance the risk and the benefits and saying, you know what? The history is what it is. But here right now, we're beyond that. And this will save lives. And I think the message has gotten through to a lot of people.
So I think I heard the same thing with testing that I heard with the vaccination as well. People are concerned about when they take the test, especially if you're talking about communities with folks who work 7 days a week, with the message out there that when you get the vaccine, you may get sick. People are very apprehensive about taking the vaccine as well. It's funny to me. I'm starting to learn some practical reasons why people are apprehensive about it. So Stephanie, I think actually when I took my first vaccine, I got sick and I asked her mom to call Stephanie to say, what is going on? What should I do? So are you finding in your research and in all that you are learning, what are some recommendations, I guess, to give people to combat that sick day or that sick moment, or if they should get sick, how should they handle that?
I think, this might be something that Dr. Holder may be able to speak to better. But I mean, definitely, I think the trusted people around, in the community are a big help. Again, like, reaching out to a healthcare provider that you trust and, getting that input is definitely my biggest suggestion. But I'll let Dr. Holder.
Yeah, luckily we do have right now, compared to the beginning, there was concerns that the vaccine could cause all these side effects and swelling. And now we've done probably billions of vaccines across the world. And now we know, for the most part, you might feel a little achy and you'll be fine. There are a few people who have severe side effects, and that's not common because it's usually younger who may have the little problems, what we see with the heart, but generally it doesn't kill. So it's rare. So I think the experience has shown us that you're going to have a little achy in the shoulder. You might feel like you had the cold. But the good thing I tell folks, if you get enough symptoms from the vaccine, your immune system is pretty on point, because that's what the immune system is supposed to do. It's supposed to make those fighters, make those cells that make your body feel like you're fighting an infection, and to increase that level. So that's not so bad when you feel that way. And in a day or two, you'll feel better. And that has helped my patients realize, like, oh, I'm feeling this. Yeah, this vaccine's really working. So it's how you frame it and understand it, and to call and have somebody, if you do a vaccine, you'll have somebody follow up with. And we did that with our Keeping the Faith initiative, where everybody left with a nurse's telephone number. Okay. So when they had somebody to call after they got vaccinated, we're still doing vaccines and they still leave with a telephone number. So whether you're insured or not, and you have those little symptoms, you feel better, because we know the vaccine is very safe for
Mhm.
99% of the folks. So that's what we found.
And it's no rhyme or reason as to if it's the first shot, the second shot, or the third shot. I know my husband with his first shot drank all this orange juice, and that became his thing. I'm gonna drink orange juice, it'll fix everything. And got sick on the second one. So it's no rhyme or reason. But we were able to bounce back, like you said, pretty quickly. Is it true that the vaccine um, consists of actually it comes from is you're injecting the actual virus itself is the word I'm trying to say. Is that a myth?
That's wrong. I don't even call that a myth. That's just not true. So, so it's no, we've come really far in vaccine technology. I mean,
Oh,
this is amazing. This is a beautiful thing about science that I love. That's why I try and share with the students and everyone that when you build on hundreds and hundreds of years of knowledge, we're now 21st century with computers that can go faster than our brain 20 times over. We're not dealing with that old fashioned way of having to get the virus or get a little piece and stick it in you and then you react.
right.
So our vaccine takes information that we can then transmit, and our bodies can use our DNA code and make the response that's necessary. So we're now giving a message to your body saying, if you ever see something that looks like this, I'm going to make some fighting cells and fighting hormones and fighting stuff that I'll be able to get rid of it. And that's what we tell the body. So when the body gets another dose, it fights it. And this really works well with all the vaccines. We don't have to do that old technology anymore of giving the actual virus. So
Okay. Okay.
that's good.
That's good information to know.
Mhm.
So we just recently learned that we are reducing, or now we're allowing children of a younger age to take the vaccine. Can you share with us what that age range is, and what would you tell parents about this who still are not quite sure?
I think it starts at 6 months. I can't remember the youngest age. I know my young from 5 and above are covered, and the younger ones are too. I'd have to give the exact age. It's the same process. Children's body, the immune system is a little bit younger and needs a different, little bit more stimulation. So they had to get the right dose
Mhm.
to be able to get the antibodies to the level. These are the fighting powers to get the level to fight the infection. Again, it's not about preventing the infection, but so you don't get sick and die, because kids were dying from coronavirus. They got many complications from the infection. So if we can control the infection to where it's just a mild symptom, we've won with kids also. And so we've been able to find the right dose. The biggest issue with children was not that the vaccine was dangerous any more than adults. It was, what is the right dose that you don't make the child too sick, or you didn't mount the right response. So
Okay.
that's why it took them so long. Moderna was just approved for 5 and above. And I have to check with the younger ones, because Pfizer definitely for the younger ones, and Moderna was just approved for the 5 through 12, because 12
Okay.
and above had approval. So again, it's about finding the right dose that will
Okay.
get you the right response. And that's where we are. We finally got the right dose. But in terms of safety, we know the vaccines were very safe in kids too. And did it get the response? It does at the right dose. So we're there now.
Now, when you say dosage, would they too have to do what we are doing? One shot, two shot, up to
Yeah.
the shots at this point?
And the way we space the vaccines in 2 shots, again, is how your immune system works. You give it a little dose at first, it starts to build up, but it can't build up enough to give you that fighting power if you get exposed. The second shot is like, here you go again. Let me prime that system and make even more. And then it makes enough after the second shot. Your body needs that little bit of recovery time between the first and the second to start building up the ability to make more of these fighting cells. So that's what we do. So we space it. So yes, they need the spacing. It's just the dose that's correct in the spacing. So they don't change like we do. We're still 6 months apart, and they still will, and but the dosing is a little different.
Okay. Um, so talk to us really quickly about, so when we first started this pandemic scenario, the death rate, of course, was just out of control. I believe that's considerably dropped. But I just wanted to talk to you two about, is that even a concern anymore? As long as people do what they want to do in the research world, are we past being concerned about the death aspect of it as much as we are the healing aspect of it and the prevention aspect of it?
Mm. Okay. As a doctor, I'm always going to be concerned about the dying part of something that's preventable. And to me, this is still preventable.
Okay.
And the prevention requires the mask, the social distancing, understanding your risk, because we can prevent this. Deaths have declined again because so many people have already been infected or been vaccinated, has the antibodies. Our hospitalization at Jackson has ticked up also. So you're getting severe disease, but we got drugs and we're able to prevent most of the deaths, but not all.
Okay.
So it is less. In the beginning, we had nothing. We didn't know how to manage the patients. We didn't know how much oxygen to put them on. There's so many steps that we didn't understand.
Mm-hmm.
Now we can manage it, the severe disease much better, so less people are dying. But it's
Mm-hmm.
still a preventable infection if we can use the proper protection, the mask, the sanitizing, the standing distance, testing yourself. Don't go around people who you think who are infected or you might be infected. If you're around older people, just assume you're infected and put on the mask and protect yourself from them and use better quality masks. That's what we also learned. If you're around older people, go with an N95, and
Okay.
they're all affordable in the stores. So these deaths are preventable. So I hope we continue to be vigilant in preventing death. I take care of a 90-year-old. My mother's 93.
Mm-hmm.
I don't think she should have a risk of dying just because she's older.
Right. Right. I
So,
agree. I
so
agree.
we need to be vigilant in preventing all the deaths.
And Stephanie, in your research, again, I'll ask you that question as well. Are you now moving forward with your research in looking at um, prevention and healing, and sort of, death is not necessarily a key factor in how you're looking at your work?
Yeah, we're taking a look less at kind of the hospitalization and death portion, but at at courses of infection and what people who do get sick, what that looks like, and prevention definitely. All of the things that we've talked about. Um, you know, in addition to masking and social distancing and all of that, testing definitely, especially with tests that can be done, at home in maybe 15 minutes or so. If you know that you're going to see someone who might be at higher risk, testing yourself before doing that, even if you're asymptomatic, or, you know, especially, if you have symptoms or know that you've been around someone who is sick, is a great prevention tool, and just doing everything that we can to control.
Do you think we'll ever go back to normal, or what was our normal of no mask, no, being able to be close and hug and kiss? We're in Miami, everybody kisses everybody. Now you have to kind of do it from afar on a Zoom. So, do you think we'll actually get back to a state of normal, or is this our world now? This is
You're asking a primary care doctor who takes care of folks for 30 years. I'm like, if I have to make a prediction for the future, of course I won that $300 million lotto. So yes, we will go back. However, in the meantime, we can get to almost normal if we do the testing, we use our protection, and we're all aware of what our status is and how we can live together. So yeah, we can achieve almost. And for some of us, all the kissing might be a relief. So you never know.
this ain't the problem anyway. So before you leave, if you could give us just some closing thoughts of anything that you really feel like our audience needs to know, must know, and where they might be able to even find you if they have any questions.
Okay, I go first. Use our testing equipment at home. It's so easy now to make testing be part of what you do. Masking, knowing your risk, getting treated, understanding the steps involved in preventing the death from coronavirus, preventing the illness, preventing the long term. We didn't even go through the long term complications.
Mhm.
But have the tools now that we can make that change for ourselves and our families and our community. Masking, testing, medication, protecting each other, and valuing each other's lives, whether they're 100 years old or they're newborn. We can do this together as a community.
Absolutely. And Stephanie?
Yeah, I mean, definitely, I think reiterating a lot of what Dr. Holder just said, testing and doing everything we can to, you know, to do what we can to hopefully return to, what we talked about, a normal state sooner than later, and utilizing all the resources that are available. Our research, we're hopefully kind of continuing to do great things, and we have a lot of research studies that are being done digitally. So we have a website that I'll mention is COVID-19 homestudies.org, where people can click on if they have symptoms or where they live or some other pieces to see what studies might be available to them. And there are others, and I know that Miami-Dade has resources available in different communities. So just utilizing those that are available to you.
Okay,
Can
thank
I
you,
give
ladies.
one more resource?
Yes.
Tuesday the 30th, it's Men's Health Month, and we're doing a session on Zoom, and it's man to man. We're going to talk about the issues around coronavirus, around testosterone, everything that men needs to know, because that's what we learned. The more health knowledge you have, just staying alive, then made you understand better how to fight the virus. And it's going to be by Zoom, and anyone can contact us at nmajwbms@gmail.com. nmajwbms@gmail.com, and we'll send you the invite. It's free. We're going to give out gas cards and things if you come in, and we want the men to come on and learn about men's health.
Okay, and if you'll send a flyer or any information,
Will.
both of you, we make sure we'll circulate that information to make sure it gets into the ecosystem.
Thank you.
So thank you both for agreeing to join us to be here today. This has been very informative to me. I think it will be wonderful for you to just listen to over and over again. So we make sure we are protecting ourselves, we're staying safe, and we're getting back to normal, whatever that looks like, as long as it's beautiful weather and kisses. I'd also encourage you to check out or Google Our Best Plan. It is the plan for Miami-Dade County, hashtag our county. Also, check out the Miami-Dade County coronavirus website as well. It'll give you all the information you need, resources you need, and where you can go if you think you need to get tested or vaccinated. So thank you again, ladies, and thank you all for coming. I'll
Thank
chat
you for
with you
having me.
Thank
soon.
you.
All right.
Great being here. Thank you.
Thanks for coming.